Welcome, Christian Shalgian. Christian has been with us at the American College of Surgeons since 2008 as the Director for Advocacy and Healthcare Policy. He's been at the college overall for more than 20 years, and in this current role for the last 12 years. Welcome, Christian.
Thank you.
In that 20 years, and particularly in the last 12, under your direction of advocacy and healthcare policy, a lot of things have happened between the ACS and the folks in Washington. And perhaps for those listeners and viewers who are not readily engaged with the activities of the college on a daily basis, you could enlighten us a little bit about those relationships and the role that we and you and Frank and Patrick play in Washington, D.C.
Thanks. We've got an incredible team in Washington that works through every level of the government, both at the congressional level, through Medicare and the agencies involved through the federal government. We work at the state level of taking the issues that are important to surgeons and surgical patients and advocating for those through changes in healthcare policy, through those policymakers, and having those relationships with staff, with members of Congress, with the folks in the administration of how can we bring the important issues that surgeons face every day and influence the decisions that those policymakers that are deciding issues that affect surgeons and surgical patients. And so every day we're dealing with those sort of issues, and we've got a great team in Washington doing just that.
What is the size of the team in Washington?
We've got about 20 staff in Washington working both at the state level, federal, regulatory, congressional. We've got 2 medical directors working with our team. We also work with all of the other surgical organizations in D.C. I informally brought together what we call the Surgical Coalition a number of years ago and have worked to strengthen that so that the House of Surgery really can speak as one united voice as much as we can.
We've spoken on this program from the front lines with both Patrick Bailey and with Frank Opelka, so hopefully our viewers and listeners remember those interviews, which were highly informative. You mentioned the Surgical Coalition. Perhaps you could just enlighten us some of the other societies and organizations, as the ACS is the House of Surgery. It's not the House of General Surgery.
Absolutely. And the college has members that are general surgeons and orthopedic surgeons and neurosurgeons and colorectal surgeons. We've got the whole group. But there are associations representing those organizations that work in Washington every single day. And we partner with those groups, whether it's the neurosurgeons, the thoracic, the orthopedic surgeons. We've got more than 20 surgical groups working with us every day, working on Capitol Hill and advancing the causes of surgeons and surgical patients. And so that's a really important point of how we can be united in the work that we do.
Can you give us an idea how many societies and organizations and or how many surgeons are represented by those societies and organizations in this coalition?
Yeah, there's about 20 or so, and it's a growing number. It started off just with those groups who have representation staff in Washington, but we've expanded beyond that and brought in a larger segment. We've got over 200,000 surgeons who are represented as part of the Surgical Coalition. So it really is a strong united front as we move forward.
Well, I am deeply appreciative, and I know all of us, fellows of the college, all 85,000, are incredibly impressed by the work you do and appreciative of your leadership in bringing that type of an effort together. It's unprecedented, and it's needed, because I understand there are some substantial Medicare cuts specifically for surgeons that we're potentially facing. Can you explain to us what those cuts might be?
Sure. What we are looking at right now is cuts that would go into effect on January the 1st, cuts that would range, depending on the surgical specialty, somewhere between 4 and 8% cuts in Medicare reimbursement. This is coming about because Medicare policymakers in D.C. have made the determination that they want to pay primary care more for office visits. And unfortunately, the situation is such that the Medicare program works in what they call a budget neutral fashion, which means that there's a pot of money and the pot of money isn't getting any bigger. So if they're going to pay somebody else more, everybody else is going to get paid less. And so because they're increasing those payments on January 1st for primary care physicians, they're cutting everybody else fairly substantial amounts, and ones that we really feel like could be devastating to the healthcare system.
So there's the balancing act of the certain pot of money or pie of money, and it's not going to change because it's a zero-sum game. But now we layer on top of that what's just happened with the financial stresses of COVID-19. How is that further impacting what's planned in DC, or at least being discussed at DC?
So when these cuts were originally announced last November that they would go into effect, in essence, 13 months later on January 1st, obviously that was pre-COVID. I think now with the COVID crisis happening and the financial stresses that all physician practices are facing, both private practice and all physicians, all surgeons are facing this year, that these cuts are going to be even more devastating. The federal government has tried to step in and provide some financial resources to doctors. We've worked closely with them to get that sort of set up, but even that has not been the answer for everybody. And there's been surgeons who have been furloughed, there's been staff cuts, there's been a lot of different things that are happening. And to pile on that with additional enormous cuts on January 1st is just going to make the system it's just not going to be good for the system at all. And so it's a very clear argument that we're making that says you can't be trying to hold the system together this year now with everything that's going on and then put cuts on top of that. That's not going to work. But as of right now, the situation is such that those cuts are still going into effect on January 1st.
Well, that's certainly a very sobering picture that's being painted. Can CMS stop these cuts, or will Congress need to be involved?
In theory, CMS was the ones who established these cuts, and in theory, CMS could stop these cuts. But in the conversations that we've had with senior CMS officials, they are moving forward with these cuts. They're moving forward with these increases for primary care, and they don't seem any willingness to back away from those. And so we've had to look to Congress for a solution, and we have very strong relationships that we've built over the years in Congress, and we've been talking to members on both the House and the Senate side and saying, can you help us here? Can you help us to get a situation where they could step in and stop these payment cuts from happening? Can we get a situation where Congress would either just stop these cuts and not give primary care the increases? But that's not going to work. Primary care, we're not opposed to primary care getting the increases. We're opposed to primary care getting the increases and paying for it through cuts to surgical care. And so we're right now looking to Congress in terms of what they call waiving budget neutrality, meaning Congress would just pay for these increases to go into effect and not cut everybody else to do it. And that, to us, is the solution that can bring the House of Medicine together and protect the system that we have.
I know that, again, through your leadership and Dr. Opaka, Dr. Bailey, there are phenomenal relationships, as well as all of your 20-plus staff at DC. What has the reception been thus far to that type of a proposal, both from folks in DC as well as from the family practitioners and internists and GPs on the other side?
We have brought together a number of policymakers, a number of members of Congress who have said, we'd be willing to do this. And so I'm anticipating in the coming days that there's going to be legislation introduced that would waive budget neutrality, that would stop these cuts from going into effect. But that's really just step one. Step one of getting a bill introduced. There are thousands of bills introduced every year in Congress, and we've got to take it from a bill introduction all the way through the legislative process, and the vast majority of bills die in the legislative process. And so we've got to gain co-sponsors and support for this legislation, both with inside Congress and also from groups outside. So we've been talking to folks like the American Medical Association, the American College of Physicians, and others that says, we've got a solution here that's going to allow primary care to get their increases, but not cut surgery in order to do that. And there has been a great deal of support for that. But the big challenge here is that waiving budget neutrality becomes a very expensive solution. And it's going to require Congress to spend a significant amount of money in order to do this. And that's always a challenge in any environment. This year is a particularly unique year where Congress has been spending quite a bit of money. And so we've got a heavy lift going forward.
What can we as fellows do to help the ACS try to stem the tide and try to waive budget neutrality and allow the folks in primary care specialties to get their differential without us getting cuts and errors?
So a couple of different things can be done. One, the college has helped put together what's called the Surgical Care Coalition. It's an additional group beyond the Surgical Coalition where about a dozen groups have put money into an effort to raise the profile of this issue from the PR perspective, telling the stories in the press, in the media, on social media. How can we get this information out about these cuts, showing how important it is that Congress address this issue. What we need individual surgeons to do is to send the emails to senators and to their senators and representatives, urging them to help stop these cuts. The college sends out emails to all of our fellows, urging them to click the links and send emails into your members of Congress. You can go on the college's website at FACS.org and click on Surgeon's Voice. Very easy to do, a couple of clicks, and you're sending an email to your member of Congress. We have to show as much support from back home on this issue so that we can get this issue moved through the legislative process. And that's essential to the work that we're doing in trying to stop these cuts.
So let me ask you a question, because a lot of surgeons, a lot of people feel, well, I don't want to do work if it's going to be fruitless. I have too much on my plate. I don't want to spend the time, and so I'm going to send all these emails. Nothing's going to happen anyway. I know from having heard you in the Board of Regents for 8 years about what I like to call near misses, some of the many amazing things that you guys have gotten done that nobody knew. It's kind of like stopping the attack that never happened because you had enough background info. So could you outline some ways that the ACS in the last few years has some of the things that might have happened that didn't happen because you intervened to help show people it is worthwhile to lend out individual and collective support?
Back a few years back, we had another cut to overall physician payments that was scheduled to occur. And we went through the same efforts of trying to get emails and phone calls into your members of Congress. I worked on Capitol Hill for years in the congressional office, and it was one of the first jobs that I had where I answered the phones and counted the emails and counted the letters that came in. And the member of Congress who I work for, and this is true across the board, they very much count those. They want to know, where do my constituents stand? The number one priority for any member of Congress is getting reelected. Everything else is secondary to that. And so they want to know, those who are going to potentially vote for them, they want to know where their constituents stand. And so when we're working any issues, whether that's a trauma care issue, a cancer-related issue, trying to get funding for the NIH, trying to get any of these issues, we want people who are passionate about these issues to let their members of Congress know. Because I and my staff, we can go into any congressional office and talk to them, but their first reaction is going to be, where do the folks back home in our district care about this issue? We need to hear from them. And if we're not hearing from them, my boss has got 47 other things that they're looking at today. And if you want this raised to the top of the list, they got to hear from folks back home. So those letters and those emails are just essential to getting stuff done. Really is, in the whole effort going forward.
Thank you so much for those insights. Thanks again for all you're doing for the House of Surgery. Did we miss discussing any key points that we should be bringing across today?
No, I really appreciate this, and I would really encourage surgeons to get involved, send those emails, talk to your colleagues about this important issue. ACS is leading the efforts with regards to all of these issues, but we really need your help as well. So I appreciate the opportunity to talk to you today.
Well, thanks so much, Christian. And I must say that if we as surgeons all had your level of passion and enthusiasm, forget your level of knowledge. I think very few of us could, maybe Frank and Patrick, but at least if we all had a share of your enthusiasm and energy, I think we would avert this problem and others. So thanks again for all that you do on this issue and on every issue for us.
Thanks.